Hi everybody, and welcome back to Southborough Connects. Or Southborough Connections. This is our first of the fall show. I hope to be having at least 2 a month. And our focus is on what affects people, particularly seniors in Southborough. Again, my name is Doug Peck. I am the chairperson for the Council on Aging in Southborough. And we are really going to start off with a really important subject this morning. I have with me Carolyn MacLeod, who is our primary Shine counselor in town. And she works with people on really getting the most out of Medicare. So welcome. I'm going to turn, a lot of the show is going to be about what she's going to talk about rather than me asking questions this time. Because there's a lot of information, there's a number of changes that have gone on, and if you don't know what Medicare is or why it's important to review that, Carolyn's really going to tell you this morning what you should be doing. So Carolyn, welcome.
Thank you.
Turn it over to you, and I'll pop in with a few questions now and then.
Okay, sounds good.
Thank you.
All right, so I'd like to start off with talking about some of our numbers from 2023 to give the viewers an idea of the scope of what we do. In 2023, we had about 1,300 enrollees that we put into new drug plans from the ones that they had, and we had total savings of $4.7 million.
Wow.
So for each individual enrollee, the average savings was $3,500.
For the 1 year?
Yes.
That's really
which
amazing.
Is monumental.
Yeah.
And this is just our region. We're in Metro West region. The scope, we go from Belmont, Needham, and then out here, Westborough, Southborough, Northborough, Marlborough. So I'm in Southborough. We work year-round, and there's some exciting things coming up with open enrollment that I'd like to talk about.
Sure.
So, have you ever heard of the infamous donut hole?
Yes. I'm still not sure exactly what that is, but I certainly have heard of it.
Yes.
Yeah.
Well, the donut hole has existed for years, and the pricing on it has changed, but in 2023, when the retail value of your drugs reached $5,030, you hit the donut hole or the coverage gap. And you were stuck in that donut hole until your out-of-pocket expenses got to be $8,000.
Wow.
So you could have that kind of level of exposure with a Part D plan or even your Medicare Advantage plan, up to $8,000 a year in drug costs.
Wow.
Yeah.
That's a lot. So what's changed?
Well, what's changed is the donut hole has gone away.
Really?
Yes, no more donut hole. The cap on out-of-pocket expenses, instead of $8,000, is going to be $2,000.
Okay.
And it starts right at the beginning. They start tracking from the time January 1st on your drug costs. And when your out-of-pocket gets to be $2,000, you're done.
Wow.
The federal government steps in, and it's called the catastrophic period, and they pay 100% of your drugs.
That's a huge savings.
Huge savings.
Huge savings for people.
Now, a couple of caveats. Your drugs have to be in your drug plan formulary. That's the formulary is all the drugs that your particular plan covers, and they have some of them send you a booklet with their formulary. Some of them have their formulary online. You should check in the fall to make sure that your drugs are in the formulary of your drug plan. And as you know, I think you've talked about the tiers.
Yes.
Drugs have tiers.
Yeah.
So tier 1 is preferred generics. Tier 2 is generics. Tier 3 is preferred brands. Tier 4 is brands, and Tier 5 is we're going to charge you so much money. You better hope you're not don't have a drug at Tier 5.
Right.
So that's how the pricing works on drugs. Some of the drugs in Tier 1 have zero cost, but some and the Tier 5s are pretty high.
So when somebody comes to you, you want to see their what drugs that they are
Yes.
taking to make sure they're in the formulary,
Yes.
and to tell people where they are at
Yes.
what level.
Yes.
So that's where it gets confusing, because a lot of people are in 5, 6, 7 or more different types of medication.
Oh, yes.
And the companies, the insurance companies, change the formularies.
Yes, they do.
Yes, they do.
So every year, people get what they call the annual notification of changes that comes out from their plan, sometimes in September, early October, hopefully before open enrollment. And they kind of highlight what their changes are, if their premiums are going to change, or if they've moved some drugs around in formularies. When people come to see us, we send them a form ahead of time, they fill it out, and they put in their drugs, the names of their drugs, the dosage, and how often they take them. And then we have a plan, a computer system that's given us by the Center for Medicare Services.
Wow.
It's called Medicare.gov. Anybody can go in and use this computer service, but you have to kind of know how to read it.
Yeah.
And so we put in their drugs, and it used to be just put in their drugs. Now we also put in pharmacies.
Oh. And you find a big difference.
Yes, because I've been doing this about 15 years, and I can't remember, about halfway through, they introduced this thing called preferred pharmacy. And if you use the wrong pharmacy with your drug plan, you could spend actually hundreds to thousands of dollars more than you should. So usually when people come see us, I put in the two biggest players in the area. I put in CVS and Walgreens.
Right.
But if they use Wegmans or they use Walmart, we put that in too. And we do a search on their drugs, and we look for plans. The first one that comes up is the plan they're in, and then it shows other plans based on costs.
Wow.
So.
Yeah, that's a lot for somebody to do.
Yes.
You know.
Yeah.
Particularly if they're not computer literate.
Right.
Or just that skilled with the computer
Right.
to do that. And that's a huge amount of money that they could be saving.
So years ago, mail order was the best option. It was always the cheapest. Not true anymore.
Really?
Do you know why?
No. Postage?
No.
Okay.
They want to get you into the pharmacy to
Yeah.
get your drugs. Because what do when you
Shop.
go in? You shop.
Yeah.
You buy more things.
Yeah.
And so mail order's not always the best option anymore for people. Yeah, so that's what we do.
Okay.
And talking about this new no donut hole thing
Right.
and the $2,000 limit. For some people, the $2,000 would be a considerable amount of money. And if they got whacked with $2,000 in January, it may be difficult for them to pay. So the federal government has come up with a system that they call smoothing. In other words, a way to make the cost go out over the year.
Okay.
And so the drug companies have prescription plan options now. And they'll contact you if your drugs are going to be in the $2,000 range. They'll contact you and ask you if you'd like to sign up for their prescription drug plan option. There's no added costs with it. There's no interest fees or anything.
good.
And you can spread it out over 6 months or even the year. The thing to remember is that when you go to the drugstore, your drugs they're just going to hand you your drugs.
Right.
You're not going to pay for them.
Oh.
The drug plan is going to bill you.
Okay.
And they're going to send you a bill.
Okay.
Remember to open your mail. A lot of seniors don't open their mail. They get inundated during open enrollment with all this mail, buy our plan, we're so much better. But you need to open your mail, especially year-round, because if you sign up for the prescription plan option, then you're going to get billed by your drug company.
Okay.
And it's not a premium billing, it's a billing for the drug costs.
Okay. So just to back up a little bit, can you tell us what Medicare covers and then what the supplement, why it's important to have a supplement plan as well? Because you talk about Part D, which is a part of a supplement plan, but only a part of it. So if you just give a little explanation, I just want to make sure people are clear about that, because a lot of people think, well, I've got Medicare. Why do I need this,
Right.
this other
other
stuff that I've got to pay for? And you have to pay for it.
Yes, yes.
And so those costs have changed, I'm sure, as
Yes,
well.
yes. So Medicare, Medicare A, well, Medicare itself, we call Part A and Part B original Medicare.
Right.
Okay. So Part A is the hospital part. It has a few other pieces to it, but if you go into the hospital, there's a deductible, and it's $1,600 and change.
Okay.
And it's not an annual deductible. It's per session, 60-day session. So if you go into the hospital in January and you pay the $1,600 and you have a relapse, say in a couple of weeks or in February, you go back in, there's no additional cost.
Okay.
But if you have a relapse in April, or you go back into the hospital in August, or you can go in October,
You got
it's $1,600 each time.
Okay.
So that's the biggest gap with Part A.
Okay.
So Part B is the doctor part.
Okay.
And it also is durable medical equipment and a few other things. But Part B, the gap is that if you go to see the doctor, Medicare pays 80% of the doctor's visit, and you have to pay 20.
Okay.
And that's every time you have a Part B service,
Yeah.
you have to pay a piece of it.
Right.
So those are the gaps.
Okay.
And Part A, the hospital part, is free for most people.
Right.
Majority of people, A is free. Part B is the one that has the monthly premium.
Okay.
And this year it's $174.70.
Okay.
It's probably going up. It doesn't normally go up more than $5.
Okay.
Some years it goes down. That's always a nice surprise. So original Medicare is not exactly free.
Okay.
It's the Part B that you have to pay for.
And it's $174 whatever per month.
Yes.
Right.
Yes. And that's if your income for a couple is annual income is $206,000 or less.
Or less. Okay.
That you're in the average Joe category. For a single, it's $103,000.
Okay.
That puts you in the $174.70 average Joe category.
Okay.
If your income is higher than that, then the Part B premium is higher, and they also add a kicker on the drug part.
Oh, really? Okay.
Yeah. So there can be more.
Okay. So then there is also the drug part, which is Part D. So it's part of a supplement plan that you have you have an option to take
Yes.
or not.
Yes. So I talk about, there's two options with Medicare.
Okay.
Okay. To help supplement A and B. Option one is Medigap plans or supplements and a standalone D plan.
Okay.
Option two is the Medicare Advantage plans that you see on TV during open enrollment. Medicare Advantage plans have drugs built into them,
Okay.
and they have more bells and whistles added to make themselves attractive. They have hearing pieces, they have vision pieces, some of them have dental pieces, some of them have even like a Visa card for going to the pharmacy and buying off-the-shelf things, aspirin and stuff, for less money. And of course, they have costs associated with them.
Right.
So when people come to see me, they're going to be new to Medicare, they come in. And I always said, if I could get $1 for everybody that came through the door that said, I consider myself reasonably intelligent,
Right.
but I don't understand this Medicare at all,
Right.
I'd be a wealthy woman.
Yeah. Yeah.
But anyway, so we talk about option one and option two.
Okay.
And I tell people how to decide between the two options based on three things. I call it the Medicare trilogy.
Okay.
The first thing is your assessment of your health. The second is your understanding of your financial situation. And the third is your risk tolerance. And when people come and see me, I tell them the pricing part and I tell them the risk part. They have to decide based on their health
Right.
which option works best for them.
Right.
So the supplements start at about $100 a month and go up. The middle one is about $200 a month, and it covers everything that Medicare doesn't cover.
So when you say supplements, that's like Blue Cross,
Well, there's a lot of different companies.
Tufts, I mean, all those different kinds. Okay.
Well,
is that part or not?
Blue Cross, Tufts, Fallon, Aetna,
yeah.
Humana, they all sell supplements and Medicare Advantage plans.
Oh, okay.
They sell option ones
Okay.
and option twos.
Okay.
Okay. So let's just take the Blue Cross supplement,
Okay.
for instance. They sell what's called a core.
Mm-hmm.
That's about $100 a month.
Okay.
And for the people that are turning 65 now, they sell a supplement 1A.
Okay.
And that's about $200 a month. And they like to name their supplements.
Yeah.
So the core is called MedX.
Okay.
And the 1A is called MedX Sapphire.
Uh-huh.
And some of your viewers out there may have something that you can't buy anymore,
Right.
but they're grandfathered in, and that's the MedX Bronze.
Okay.
And then a few people have MedX Gold.
Huh.
But that monthly premium is now $980
Wow.
a month.
Wow.
Wow.
See, this is why you've got to go. Whether you're a full-time or not, your plan may have changed more than you realize, because I know I get all my all the information, but I open it up and it's 10 pages. It's like, I don't really understand it, and I've worked with it for a long time myself to know what all the changes are, how that's going to affect me. And I think as you get older and certain health things happen to you, your risk tolerance changes.
Mm-hmm. Oh, yes.
Right? Because now if you're 75 instead of 65, you may be in a whole different category. And so you really, if you know that there might be something going on in your near future, you've got to
Right.
plan for that.
Right.
Because this is a yearly thing that you sign up for.
Yes.
That's the good news.
Yes, that's good
right,
news.
is that you're very flexible and you have only 1 year that you make a commitment to it. But on the other hand, you have to go through this every year.
Yes.
So
yes.
you
So,
do.
so in terms of open enrollment,
Mm-hmm.
so the supplements are steady. They're pretty steady.
Okay.
I mean, the coverage doesn't change based on whether you pick the core or the supplement 1A.
Okay.
There's risks with the core.
Mm-hmm.
There's more risk with the core than the 1A.
Mm-hmm.
But some people have more risk tolerance than
Right.
others, so they'll take the core
Right.
instead of the 1A. The thing that changes the most with the option 1, you have a supplement, and then you have the standalone drug plan.
Okay.
Those are the Part Ds.
Okay. Yeah.
And those are the things that change the most every
Okay.
year. So I usually tell my clients, if you're a supplement and a Part D standalone drug plan person, you should have your drug plan checked every year. The Medicare Advantage plans are pretty steady Eddie. They don't change that much from year to year. But so getting back to, let's just talk about the Part D plans. Last year there was a new plan on the market. The premium was 50 cents.
Really?
50 cents a month for the premium.
Right.
And some of their drugs in Tier 1 and Tier 2 was zero. It's a well-care plan. I changed a lot of people to that plan.
Really?
Now, whether it stays 50 cents or not, I don't know. In other states, actually Florida, the same plan's zero, has no
Really?
premium, which is kind of interesting.
Yeah.
Yeah, so people come in, we put their drug information into the Medicare.gov account system, and we tell them what plans work for them. They can stay where they are, they can switch, we can do the switch, we can enroll them right in the office. That's what we like to do. That's where we saved people how much money last year?
Right.
$4.7 million. So yeah,
Wow.
yeah. So those are the Part Ds.
Okay. That's, yeah.
Yeah.
No,
Yeah.
it's important to sort of spend a
Yeah.
day or so
Yeah.
really going
Yeah.
through this and collecting the information for you.
Right.
That only helps them to have all this information anyway on hand in one place, but you absolutely need it to be able to make these kind of complex decisions, because you also have, is my doctor now part of the plan?
Oh yes, that's more on the option 2 side.
On the option 2 side,
I'll
yes.
get to that in a second.
Okay.
But I want to talk about the risks with the supplements, Medicare
Okay.
plans. I talked about the pricing, about $100 for the core and $200 for the 1A. The difference is the risk between the two.
Okay.
With the core, you're still subject to the hospital deductible. Doesn't go away with the
Right.
core. You also have to pay what's called an annual Part B deductible. So the first time that you go to the doctor's office, you have to pay like $240 or something like that, and then you're done for the year. And then there's another risk. If you get seriously hurt and end up in a place like Spalding or Whittier, a skilled nursing facility, and you're there more than 20 days, you have to start paying $204 a day,
Wow.
which is considerable.
Yeah.
So that's the biggest risk with the core.
Okay.
So we have a lot
It's
of
those out-of-pocket risks.
Yes,
Okay.
yes, out-of-pocket risk. So we even have Shine clients that have the core.
Okay.
Because they're willing to take the risk. I'm going to save about $1,200 a year.
Right.
Price difference. And if I go into the hospital, I could pay the $1,600 deductible.
Right.
So the biggest risk is really the skilled nursing
Yeah.
issue. So with the Supplement 1A, there's no hospital deductible.
Okay.
There's no skilled nursing risk. The only thing you have to pay is the annual Part B
Is the annual
deductible.
Part B deductible.
So some people riskier than others,
Yeah.
risk tolerance.
Yeah.
So that's the biggest difference in option 1.
Right.
In option 2, which is the Medicare Advantage plans, those are the ones that you have to stay in a network, or you have a plan like a PPO, you stay in network, or you go out of network, you usually pay more
Pay
out
more.
of.
Right.
Now, a Medicare Advantage plans, you can get one for $0 a month premium. Zip. They have plans that run in the $50 range.
Right.
And then they have plans that start at $100 and go up. I usually tell people when they come in that we're going to focus on the 0 plans and the one in the $50 range, because if you're going to pay $100 plus, you might as well get a supplement where you have, all you do is pay your monthly premium. With the Medicare Advantage plans, there's co-pays every time you do something.
Right.
You go see your doctor, you go see a specialist, you
Right.
have an MRI,
Yeah.
you have physical therapy,
Right.
there's co-pays.
Right.
The risk with the Medicare Advantage plans is the maximum out-of-pocket you pay in co-pays. So with the 0 plans, that maximum out-of-pocket, it's not a deductible, it's the maximum out-of-pocket you would pay in co-pays is about $7,500.
Okay.
Okay? With the plans in the $50 range, the maximum out-of-pocket is around $3,500.
Okay. That's a big difference.
It's a
for
big
some people.
difference.
Yeah.
So for some people, they say, oh, I'll take the 0 plan. I could afford the $7,500 if I max out my copays.
Yeah.
For some people, that would be too much of a stretch.
Right.
So they
Right.
prefer the $50 plan.
Right. $50 a month.
And then
it's
and
easier to-
their risks, their maximum exposure is about $3,500.
Right. Yeah.
So they pick that.
Yeah.
The other thing that's attractive about Medicare Advantage plans is they offer more things.
Right.
The supplements or the Medigap plans in option 1, they don't cover healthy eye exams, for instance. They cover eye disease, cataracts, glaucoma. But if you wanted to have an annual eye exam, you'd have to pay out of pocket. With the Medicare Advantage plans, they're designed to keep you healthy.
Right.
So they give you the annual eye exam. They give you a lot of things that
Money towards weight loss,
Yes,
health
oh,
clubs,
absolutely.
all those
Yes,
kind of things.
yes.
That's when you find in those
costs
plans.
off of hearing aids,
Right.
big dental issues where
Right.
you get annual cleanings and bite wing x-rays and
Yeah.
stuff like that. They want to keep you healthy.
Yeah.
So that's kind of the concept with Medicare Advantage plans.
Okay.
The biggest drawback with Medicare Advantage plans
Mm-hmm.
is that you need to take a plan that your primary care physician takes,
Yeah, right.
or you got to go find another one.
Or I have to go find out.
And
Yeah.
you know the story in this day and age,
Yeah.
since COVID.
Right.
Primary care physicians have left the market
Yes.
in droves.
Right.
Some of them have become concierge doctors.
Right.
Finding a primary care doctor is hard for people nowadays.
Yeah.
So when people come and see me, I make them do their homework and check and see what Medicare Advantage plans their doctors take.
Right.
So that I don't put them in one that they go to see their doctor
Right.
and they're rejected.
Right.
That's not good.
And sometimes, I've had this happen to me, if you call the office, they'll tell you what plans that they take, because they're dealing with it.
Yes.
So you don't have to go scrounging around looking for information. Just call your doctor and say, what plans do you take? and they'll tell you, and it simplifies things for you. Then you can look at the other
Right.
aspects of the plan. But you're right, that's an important piece, because they're not easy to come by.
Right. But I want to caution people.
Okay.
I usually tell them to call the billing or registration offices.
Oh, okay.
And not the doctor's office.
Okay.
Directly. Because
Yes.
Blue Cross sells supplement plans and Medicare
okay.
Advantage plans.
That's a good
Tufts
point.
sells supplements and Medicare Advantage
Yeah.
plan. So if they say, oh, we take Tufts,
Right.
it could be the supplement and not the Medicare Advantage
Okay.
plan.
So
So they have to
call
be,
the
oh, I'm
billing.
sorry,
That's
they have
okay.
to be very careful. Sometimes we can figure it out online on the computer, and they some places give information. So most of you in Southborough are familiar with the Reliant Group, which
Right.
is on Newton Street,
Right.
and now they have a place in Westboro. The Reliant Group takes almost all Medicare Advantage
Oh, wow.
plans. They do.
That's good. They want the business.
Yes, they do. They love Tufts, and
Yeah.
they'll direct you towards Tufts. But they take the Blue Cross plans. They take almost all the Medicare Advantage plans. But another group in the area is Charles River. They only take Tufts Medicare Advantage plans. They don't take any other
I know.
Medicare Advantage plans.
It's my group, but I've had really good luck with them. But
With Charles River?
Yeah.
Yeah.
But
yeah.
you know, that is the downside
Yeah.
of it. I just also want to say one other thing. Shine is not selling any one plan. Carolyn is a volunteer. All Shine counselors are volunteer. They don't get compensated by the insurance companies. And that's really important, because when you call, if you're going to call a number that you see on the TV, and you're going to start seeing a lot of them, they all have their preferred plans that they're going to try and push you towards.
They're
So,
brokers.
they're brokers.
And they're paid.
They're paid. So let's not make a mistake. You know, if you want a really objective opinion, Shine is the way to go, always. So call if you want those other plans, because they're very enticing the way they do it on TV. And you can get easily into a low, 50 cent a month plan or a zero plan, but it's got a lot of ramifications that you really need to understand. So I think this was terrific. I want to thank you very much. So what do they need to do if they want to see you or a Shine counselor?
Okay. So call the senior center, Southborough
Okay.
Senior Center, and you will be directed to a special line. And I have a charming woman that does my scheduling during open enrollment, because the load is too much for the regular staff.
Right.
And Helene will call you back and schedule you an appointment. And then you will get a form to fill out with your information about your current coverage and what drugs you take.
Right.
And then you come see me.
Right. Do that as soon as you can. These slots fill up very quickly. So
Just starting this week.
that's
is
why
when
we're
you
doing
can
this
call.
right away. So, put that on your to-do list and get that done, because it could end up saving you, really a couple of $1,000s this year on your medical bills, and it's just so important to do. So, hey, I want to thank Carolyn for coming again this year and doing it.
It was a pleasure.
We're going to do this every year, because there's always new people, and there's always new people that get the information in the mail and end up being confused by it and really need somebody to help straighten them out. So I look forward to doing another show. We're going to do some more on things such as insurances, look at different programs that are around, such as the PACE program and other things that people really need to know about, but they're complicated, and it's hard just to sit down by yourself and read them. So look for some up-and-coming shows on that, and for more information on the Senior Center. We are having a big open house for our new room on September 18th in the morning. If you're up and about and would like to come and join us and celebrate with us, because it's a really big addition to the Senior Center, you're welcome to come. So thank you very much. This is Doug Peck again. I'll see you in another week or two.
Thank
Take
you,
care.
Doug.
You're
It's been a
welcome.
pleasure.